hear me. I'm Cheska Colorado Mansfeld. I'm the co-founder and CEO of MiracleFeet, and I'm joined by Daphne Sorensen, who is our president, and I'll be speaking first and then she'll talk a little at the end. First, thank you so much for this incredible opportunity and also for the amazing support that we've been getting from ATIF. It's so exciting to see the energy, the interest, and the momentum around assistive technology. When we first started MiracleFeet 11 years ago, we felt like we were completely on our own, and it really does feel like there's a community now, all motivated and energized to work on this together. So it's just tremendously exciting. So thank you for all of that. Very quickly, what is the issue that MiracleFeet is tackling? So we work on the issue of clubfoot. Clubfoot is a very common birth difference, and it actually affects 1 in every 800 children born worldwide. That's a lot of children. Because 85% of those children live in locations where it's difficult to access treatment, clubfoot is one of the largest causes of physical disability in the world. And if it's left untreated, clubfoot severely impacts people's mobility, making it very difficult for them to walk easily and without pain. Yet, it's very treatable. So clubfoot is highly treatable with a very inexpensive and effective treatment that doesn't even involve any major surgery, that takes about 2 to 3 months to complete and works in 95% of cases. This treatment is routinely available in wealthy countries. And so, you know, it's perfectly possible for us to tackle clubfoot and end this as a cause of disability. The treatment, part of the treatment, and you can see it on the slide here, there is a purple brace. This is the assistive technology part of treatment, and it's used once the correction is completed, but it's absolutely an essential part of treatment, and children are not fully treated unless they have access to this brace. It's worn only at night, so it doesn't affect children's ability to learn to crawl and to walk and to play with friends or go to preschool. But it's a very, very critical piece of treatment. And so what MiracleFeet was created to do is to scale this treatment around the world. And most of that work so far has been focused on the lowest income countries and reaching the lowest income populations in those countries. And we've done that by working with government hospitals. We train doctors and physical therapists. We establish referral pathways so that children are identified and get to treatment at an early age. We raise awareness and destigmatize disability so that people access care. And very importantly, we work with governments to put in place guidelines and policies to support clubfoot treatment and to make sure that it gets mainstreamed into the health services that they're providing. Under this model, we have given away the brace, and we've done that because it's been the easiest thing to do, and because we are really working with very, very low-income families. And through this model so far, we've been able to treat our partners, our local partners in all of these countries have been able to treat 61,000 children. They've been enrolled in treatment in 300 clinics in 29 different countries around the world. So that's what we've been able to do so far before ATIF. And if we could have the next slide, please. What we're trying to do with the ATIF project is actually explore a new way of working and providing treatment, and a model that will work to reach middle-income populations in middle-income countries and in lower-income countries where there is a growing middle class. What the project is enabling us to do is to sell the brace to families that can afford it. And just a little bit about this brace, the brace is a small part of MiracleFeet. We found ourselves in a position where we had to develop this piece of assistive technology because as we were trying to scale treatment, this just wasn't available. There were very inadequate options available, very expensive braces imported from the US or locally made in little workshops around the corner from hospitals, and it was very hard to scale that, and the quality was really variable, and it was very difficult to manage. So we ended up developing a brace because we really, really needed it. So we didn't develop it to sell. We developed it because we saw this desperate need, and we can produce this brace for $20. The regular ones used in the UK or the US cost anything between about $350 and $1,600. So a very, very dramatic price reduction. But we designed it with 3 things in mind. We wanted it to be mass producible so that we had consistent quality and could very quickly provide inventory wherever we were working. It needed to have all the functionality that the wealthy country braces, for a better use of the name, had. So like clip-on shoes, so it's really easy for parents to use it. And we wanted it to be attractive. And Brenda just spoke so eloquently about the importance of eyewear wear and how design is so important. And we also believe that that's true. If you have to put a brace on your child every night for 4 years, you want that to be something that gives you some joy and doesn't feel like too much like a medical device. If you could go to the next slide, please, that would be great. So this project is really important to MiracleFeet for a number of reasons. One is that it's just so clear that there's an enormous gap in the market. It's very difficult for a doctor who wants to treat clubfoot well to find braces for his or her patients. And the brace that we designed, fortunately, fills that gap in that it's very affordable at the $20 price point. That's what it costs us to produce. And it's very high quality. So parents and providers love it. And so we want to make sure that it's available even where we're not working or for families that aren't seeking care through government hospitals. We also recognize that clubfoot is still not well addressed in middle income countries. We hear a lot of stories of the frustrations of families who go to private hospitals and then find that they don't get good treatment, or that braces aren't available at the end of the casting phase of treatment. So there's a real need for our work or for somebody's work to address clubfoot in middle income countries. But we also believe that it shouldn't be costing us as much as it's costing us in low income countries. That there's more ability for families to contribute to care, and for governments and the health system to support treatment. So we're looking for how do we refine our model for a middle income market, and selling the brace is sort of a very key part of that. So that's why this project is so important to us. And then finally, the hope is that this will generate some revenue and make MiracleFeet a little less reliant on charitable grants and so forth. And hopefully will also make us more attractive to other kinds of funders as we move forward. So those are the reasons why we care so much about this. We, like WASI, have made extraordinary progress and are so grateful to the technical support that we've received from Brink and from Catalyst in doing this. We couldn't have done it alone. The project is in Nigeria. And very quickly, we established that it didn't make sense for us to be trying to sell directly to consumers, to the patients, that we had to go through doctors. So that was a key finding early on. And that led us to find 3 locations where we could pilot selling the brace: 2 public hospitals, and then recently OADCPH, which is another grantee of ATIF, which is exciting. They're all very enthusiastic, and they, like us, see the need. They have confirmed all of those findings. The feedback on the brace has been extremely positive, both from the families that have seen it and from providers. They're very excited about being able to access this brace. And then we have developed a financial model with support from Catalyst that we are now starting to use as we explore other commercial opportunities outside Nigeria, with Ecuador being one of those. So we really feel like over the last few months, we've not just learned about the brace, but we've really sort of got deepened our understanding of how we're going to tackle middle income countries. So what comes next is that we're going to complete these pilots, and the hope is that we're going to get a lot of feedback on what kind of price point is manageable for people, and how do the doctors sell the brace? So not necessarily actually sell it, but how do they persuade families to use it, and does it help with compliance? Another challenge is getting the braces to OADCPH. In Togo, we have already gotten them into Nigeria, and that's been fine, and starting to see whether a regional approach might actually make more sense. And then deciding sort of where do we take this next? And the hope is that we can continue to do the work in Nigeria, but also really explore some other locations where this project might be relevant. So next slide, please. And I'm going to hand over now to Daphne to finish us up with the key learnings.
Thank you, Cheska. Thanks. It's what a great opportunity to be here. So this is a slide really about our key learnings. But as you can see, the key learnings on the slide, I won't read them off. Instead, I'd like to home in and expand on the second bullet about the need for more government guidelines to drive AT demand. Simply put, commercialization of clubfoot braces doesn't happen in a vacuum, and it can't be done piecemeal. Because the brace is part of an entire yet specific treatment for clubfoot, the demand for braces will only happen if or when there's an enabling environment that promotes this approach. In Nigeria and other countries with similar characteristics, we need government to, among other things, raise awareness of clubfoot, set national treatment guidelines, and integrate clubfoot treatment as part of the national training curriculum of healthcare professionals. Now, as obvious as this sounds, more braces alone don't solve the problem of untreated clubfoot in Nigeria. The good news is that we're confident that any additional investment in Nigeria that takes into account the important task of developing an enabling environment will ultimately be successful. After all, there are approximately 10,000 children born with clubfoot each year in Nigeria without fail. That so many of them are falling through the cracks when we know what it takes to treat them is a problem we can solve. Thank you.